What is diabetic retinopathy? And this is a condition which affects the retina in people who have diabetes due to the effect on the retinal circulation. So you get abnormalities in the circulation which cause leaking of blood or fluid within the retina, and if this affects the central part of the retina, known as the macula, it can severely affect vision. The other way diabetes can affect the eye is stimulating the development of new blood vessels. And this occurs because the capillaries, the fine capillaries which supply the retina, become occluded because of the diabetes, and then the eye tries to make its own new blood vessels to bypass this, and these blood vessels are fragile, they bleed, they leak, and you can then end up with scarring within the back part of the eye, which can result in retinal detachment, and if untreated can lead to blindness. So it's very important that if you have diabetes of any description, that you have regular checks, and there are many screening services throughout the country where people are examined on an annual basis. If you do develop retinopathy, so there are two types. One is called background retinopathy, which affects the central part of the eye, the macula and surrounding regions. And if you have leaking blood vessels, which you can identify, it's possible to treat those with a laser to spot weld them, to close them off and stop the leakage. If you have overall swelling of the retina and the macula, then it's possible to use the drugs which are used to treat macular degeneration, so Eylea or Lucentis, and they are given and to work on the retinal circulation to reduce the leakage, and are extremely successful in improving vision in those patients. If you develop new blood vessels within the eye, then that needs, at the very least, very careful observation, but more likely than not to have some form of treatment. Traditionally, this has been done by laser, so you use a laser to destroy the parts of the retina which are not working because they haven't got sufficient blood flow, and are causing the stimulation to develop new blood vessels. And more recently, people again are using the macular degeneration drug Eylea and Lucentis to kill off the blood vessels, and there is now evidence that this is an effective way of treating what's known as proliferative diabetic retinopathy. So it is key that if you have diabetes, that you have regular checks on your eyes and on your retina, and that if you do develop retinopathy, whether it's the background retinopathy or the proliferative retinopathy, that you're monitored by an ophthalmologist and appropriate treatment instigated.